How do psychiatric treatments work? Surprisingly, I have found that not very many people know the answer to this question. Even psychiatrists are often confused. Normally, in medicine, you have a pathogen or a disease process that can be targeted with an intervention. If you have staph infection, you kill the bacteria with an antibiotic, such as dicloxacillin. If you have a yeast infection, you kill the fungus with an antifungal, such as ketoconazole. If you have a viral infection, you use an antiviral medication. If you have breast or lung cancer, you take methotrexate to kill the rapidly growing cancer cells, and so on and so on and so on. Now, most people think of medicine in this way. You have a known cause of an illness, and you get rid of it with a proven treatment that directly targets the cause. That is not how psychiatry works. In psychiatry, you have brain chemicals, like a big soup of brain chemicals that are functioning improperly. There's too little production, or there's too much production, or the chemical is not produced at the right time or in the right way, and nobody knows exactly why. This chemical alteration may contribute to the symptoms, but is not the cause of the condition. The treatment simply aims to restore a normal amount of the chemical and allow your brain time to adjust to the new amount. The chemicals we are talking about control all your bodily functions. But when I say control, I mean in a regulatory way. That is to say, these chemicals increase or decrease to compensate and maintain homeostasis, which means stable function. For example, when you need your muscles to be stimulated in order to walk or digest food, the neurotransmitter acetylcholine is increased in a specific targeted location. When you need your muscles to slow down, the inhibitory neurotransmitter dopamine is increased in a specific targeted location. Other chemicals, or the main chemicals in the brain, GABA and glutamate, these are neurotransmitters that make up 95% of all neurotransmitters, and they antagonize each other so that one is excitatory and one is inhibitory. Most other neurotransmitters perform their job by making slight adjustments to the balance between these two. There are also immune-modulating neurotransmitters and hormone-regulating neurotransmitters. The point is that the function of these brain chemicals is to regulate bodily processes. When they are altered, there is an overcompensation or lack of compensation that needs to be corrected to get back to homeostasis or stabilized physiology. Psychiatric treatments work in this milieu. These treatments do not target causal factors. Rather, they alter chemical function to restore homeostasis. Through the process of scientific discovery, we have figured out many medications that alter brain chemicals. Before we had medications, or before we had medications or even knew about the brain chemicals involved, we tried hypnosis and talking therapy, and these things worked. Once we discovered medications, the field of psychiatry split in two. Half wanted to talk, half wanted meds. We are now coming full circle as we are discovering the new neuroscience of the placebo effect. We are understanding how non-pharmacological therapies can work by altering brain chemicals just like the drugs do, but in a more specific and long-lasting way. We're even learning that if you practice the non-pharmacologic interventions, over time you can cause changes in your brain in terms of making new synaptic connections, and these changes can persist or be permanent or semi-permanent. We are also learning that optimal results for the toughest cases occur when both pharmacologic and non-pharmacologic treatments are used together. I would like to integrate the two disparate philosophies in psychiatry, often called organic versus functional, at least that's what they used to be called, into one holistic treatment approach that incorporates both. This will mean that the functional folks will need to abandon some of the more expensive and invasive and risky procedures that haven't really proved very effective or have been proved to be completely inert. And they will need to focus on using non-pharmacological treatments that really do alter brain chemicals and clinical outcomes and aren't as risky. Likewise, Organic psychiatrists will need to reassess how they are administering their treatments and draw some of the art back into what they are doing to maximize outcomes by maximizing the placebo effect.